All right. Now, if you're listening to Dr. Sarni, what tests can check you for sensitivities?
Clifford.
That's right. High compatibility. That's right. All right. Oh, you got another one of those? No, you need something different. You need a crystal.
Thank you.
All right. Now, with the Clifford testing, is it more, do you remember how much they said? Like how many materials? This is like just not for,
5,000 or something.
that's right, 6,500 or more dental materials. Now, who would think that you could be allergic to a dental material, right? Well, if you're allergic to food, you're allergic to environment, you're allergic to like creams and moisturizers, why can't you be allergic to materials?
So is the Clifford test just strictly for dental compared to like the Melissa test?
Yeah, the Clifford test is specifically for dental materials. So any kind of material that we would use in a dental office, it's testing those materials. You know, they take your sample and they send that off and they have it, they do the reactivity test. And if you react to certain substances, you know, they know they got to use that.
Does everybody come back with some type of an allergy?
Well, that's hard for me to answer. That's
Oh.
something that you probably talk to the doctors more because they decipher the forms. But somebody who has a predisposition to a lot of sensitivities and allergies, it's probably a good idea to get a Clifford testing.
Yeah.
You know, because that way, you know, no material is used that you could react to. A reaction doesn't have to be a full-blown allergy. It could be an irritation, or it can actually affect your immune system. It could suppress your immune system, so now you're going to be reactive to something else. All right. So if you can't use zirconia, like we have zirconia implants, or if you can't use certain metals, then we can't use that. If we use, you know, certain other materials, you know, that what has happened over the years, they've kind of congregated all of the information, and there was like a list of common things that people were sensitive to. So they've now eliminated that from their protocol downstairs. So these are the common ones that we see a lot. We don't use those at all. So, but we're still testing for it, and we're testing for other things. So that's why it's great, because you go to the dentist, I'm getting the fillings, and then all of a sudden my tooth's still bothering, my gums are sore, my gum is sore. Why? They go back, oh, it's just something you need to brush better. They scale it out, and they say, oh, it's fine, you're doing all right. But it's not. You're having a reaction to it, right? You're having a reaction to the cement or something. So we look for all the root causes of problems. So.